Today's event is part of a series of events we've been having as we try to reach faith communities throughout the area which the Trust serves.
One of the things we would like to do, and our chairman said it, was in relation to actually going public with the figures we've got for young black people in mental health services, how many are sectioned, and we'll come the next event, not in a year, in a couple of months we will come and we'll go public with those figures, and then we'll have an adult conversation about it.
In 2009-2010, 34% of the people who were detained under the Mental Health Act were black. In 2010-2011, that had reduced to 28%, but nevertheless it's still a considerable difference between the number of people who are detained under the Mental Health Act and the percentage in the general population.
The church is a tremendous institution within black communities. Black majority churches are growing in congregations, in their influence, and a place like the New Testament Assembly Church here tonight is at the heart, is down the road from the Mental Health Trust.
What they have found is that the people who have drawn to this kind of services are the people who don't want to talk. Not everyone wants to talk. Not everyone wants to sit down and have a conversation about how they are feeling.
Black backgrounds are more likely to be detained in hospital. We need to challenge ourselves about why that is and what we can do about that in the future.
The power to change is not actually in the hands of the institutions, it's in the hands of the communities themselves. So this year's conference was called or framed around the social factors that impact health.
Today I found extremely challenging, particularly when the focus came on the young people. Because if we don't actually invest in their mental health, that will determine how many people in adult life are going to be living a miserable, unfulfilled life, because there were issues when they were younger, and we didn't have a social system and a health system that could address, they could feel comfortable to come and say, I've got an issue, I've got a problem.
The NHS would not have flourished without the Windrush generation and without the toil and hard work and commitment of us, our parents, our relatives, people like us.
I guess my job is to carry on the work that Dave has done, but more importantly to carry on the work of the community and to make sure that this trust doesn't see itself as an isolated trust, but is as part of the community.
There was nothing there for my mum, and there definitely was nothing there for me while I was navigating my own mental health and so forth. So that's what you would see in there. So you would have seen the police brutality my dad went through. If my dad went through it, what do you think was happening at home for me? And my brothers, and my mum? Unemployment, no housing, and as I said earlier on, no culturally competent service to understand his lived experience and where he's coming from.
Well, this is a recall conference. It's a recall of our 15th conference last year. Because last year the partnership was under a great deal of strain. Because we felt that we've been doing this for a very long time, and that MIP itself has been running for 4 years now. And we felt that we weren't making the progress that we should be making by now in terms of reducing race disparities. So this is a recall conference to try to understand why that was happening and in order to rebuild the partnership.
And I've learned from people like Malik, who's been, I have to say, very patient with me in explaining the impact of the mental health system on the communities that he works with and he represents. And the conclusion I reach is I simply cannot accept what currently happens. It is not an acceptable state of affairs.
I think it's very good that this event is taking place. We've got to have this discussion, and we've got to confront the structural racism that sort of pervades the mental health system. and I pay a lot of tribute to Malik and colleagues for his persistence and for getting this properly on the agenda. And I totally share his view that we've got to deliver change.
I haven't heard that today. I haven't heard the new generation of theorists that are in this room that's going to create a diagnostic framework that represents who we actually are. That's the first thing. So I encourage people like Gabrielle to start producing those frameworks. Black women to have a black feminist perspective. This is crucial. We've got to approach a reality that relates to who we actually are. I think what I was trying to express through the talk was that we need a radical shift in terms of how we diagnose people under the Mental Health Act. So we need an Afrocentric approach. We need to dismantlise the system that's created the criminalisation of the black experience. We need to challenge the way people are illegally detained under the Mental Health Act from Section 1, which is the definition. We need to remove some of those legacies of what we call depomania, that we are slaves underneath the system. If we run away, we're brought back. We need a huge redistribution of resources, huge levels of accountability, and real empowerment given back to lived experience.
I think what I always think about these events is it's nice to sometimes have people be able to convene. I think that the South London and Maudsley Trust needs to replicate what this trust is doing here, and have the ability for all levels of individuals to come into the same room and speak. But that being said, sometimes they need to be able to listen and be able to have conversations that aren't replicating those power dynamics. You know, we shouldn't have kind of less black speakers when it comes to a black mental health conference. We shouldn't be in a space where we're having to reference the snowy white peak of the NHS.
Because we've been doing this work, as Bishop says, for 16 years. 16 years we've been doing this work, and that 16-year work stands on the shoulders of people who have been doing this work for 20 and 30 and 40 years. So we've been doing this work a long time. Yet in that period of time, have we moved the dial on race inequalities? No.
So even with all of the evidence, even with agreement from all parts and corners of politics about the inequalities that exist, about the injustices that exist, we're still doing nothing.
I think it's a testament to the human spirit that people keep going. When they don't get the support that they're fighting for, or the help that they need, or the funding and money and so on. But it's disappointing as well. You sort of think, why haven't they got the money that they need? Now, I understand that Malik has got some funding behind all of this, and they've also got Sashi Duran involved in doing the evaluation of it. So I'm wanting to work closely with them so that we develop our new models of care and at the same time develop a community of practice.
I have no desire to keep the communities out. The communities know what they need. And we have to provide evidence-based care and treatment. So it's both and. We have to work together. We need each other, yeah? We're no good without each other. What would be good in the next few years is to continue shifting power and resources into our communities, and I remain absolutely committed to that, with the right accountability and frameworks around that.
So I can hear Vanessa and the mental health system talk about, oh, it's not safe, the staff are doing good work. The staff are not doing good work. Because if it was good work, those figures would change.
And Malik, in spirit of partnership, we agreed we weren't going to do this. We had a really clear agreement that we were going to stand together
and talk about the issues.
And talk about the issues, and we were going to bring our community with us. And I wasn't talking about psychological safety just for my staff. I was talking about psychological safety for the people that I serve, and that includes all of my patients, all of their carers, and we need to progress in that spirit.
Completely right.
Absolutely.
Completely right.
As a community organisation and as an institution that Vanessa represents, we have different starting points. Our starting point as a community empowerment network is to represent the authentic and credible voice of the community. And even though the institutions say that they are there to serve their communities, they also have other masters. And their other masters are paymasters and institutional masters and government masters. So sometimes they serve institutions more than they serve communities. So for us then to say, well, okay, we understand we come from different spaces, let's now work together, will by itself generate a lot of tensions.
Oh, I mean, it's hard work, isn't it? I mean, we've definitely got the flavour of that today. It's emotional and it's personal. This is about people's lives, you know. We've heard so many different stories about people's lived experience, the way that they've been treated by institutions. We've heard about the institutional racism that exists within the NHS. So it's undoubtedly there's so much work still to do.
These events are very important. I do feel that we need to have the discussion between ourselves more, because we're relying on people to save us, and I think it's clear we're not being saved. We need to save ourselves. So every individual needs to be taught how to make themselves better, and also we can help others to bring ourselves up. So yeah, I think we need to come together a bit more for ourselves. And yeah, but events like this, Malik is doing great work. I think he's fantastic. He speaks on our behalf very well, and we just need to keep doing that.
The key interventions that we're currently not doing, if you look at the red diagram, MHIP is not MHIP unless these things are also implemented. And they cannot be the MHIP program. We can't be confidently talking about we're doing MHIP, we've got Hobv, we're doing we can't do that confidently and authentically unless we bring these programs in. And the conversation we're having at the Trust at the moment, and Vanessa might want to speak about that, is how do we build communities of practice around this, which are Black-led from the staff of the organization and others, to start forming the case for change in these areas, and that's what we want to do next.
Well, I think what IMIP should start doing is have employed legal advocates that work with people that are mentored, who are admitted under the Mental Health Act, and should they be challenging the system and the processes about legal recalls, about people legally detained. It's got to get politically serious.
I think the contribution from Courtney Brown and his organisation in particular was very powerful, because what he reminded us of was the everyday lived experience of what it's like to be a Black man and growing up in London. And actually that's what we should be focusing on.
I think that we have reached a tipping point in mental health, where a lot of professionals agree with service users and their families that we've got a system that is fundamentally reactive, risk averse, and is all too often untherapeutic. And we've got to change it. And I think we're now at a point where even people up at the top of the NHS are wanting to see a new kind of mental health.
So the only way we can affect change is by working with people from the communities. People here at the conference, for example, we're involved in something called the Patient and Carer Race Equality Framework, which is all about organisations like ours working with communities, breaking down barriers, building trust, but also us being willing to confront where we're failing in quite profound ways.
Well, at this conference we agreed actions. We've agreed actions before, but the time window is now shorter. It's 6 months, because the next conference is until October. There's a number of things that we need to do with the current key interventions that we have in place, the Hobvs, the Crisis Family Alternative, and we need to expand them. We agreed to do that today. We agreed also to have a greater focus on rights and justice and advocacy for people who are detained under the Mental Health Act. So we need to do that. But also we agreed that the remainder interventions of MHIP need to be invested in and focused on. So I hope what today has done is put a marker down that we as a collective community, including the Mental Health Trust and the ICB, are committed to that.
Today's conference has been different because we are both being held accountable. We've moved into a different place in our partnership. It isn't a campaigning organisation holding a big institution. The campaigning organisation is also now delivering on some of the MHIP interventions, and that means that we need to both be held accountable to each other, and I think again that's been a really important step forward.
And in 6 months, let's get key interventions in place and starting, because it's going to be an incredible change for the way that we look after our children and our grandchildren here. Thank you.